My name is Magni Hamso. I'm an internal medicine physician at Terry Reilly Health Services here in Boise, Idaho. I'm also a clinical instructor with University of Washington Boise Internal Medicine Residency Program. I'm here to talk about hepatitis C. Hepatitis C is an infection that affects the liver, and it's actually quite common. Depending upon where you look, estimates range from 4 to 6 million people living with hepatitis C in the United States. And it is a disease that over time can cause problems with the liver. It can cause the liver to fail and people to get really sick. It can cause liver cancer. Fortunately, over the last 5 years, we've had some amazing new treatments come out, and we're actually able to cure hepatitis C in the vast majority of cases. And it's an easy treatment, typically a pill a day for 2 to 3 months. Recently, we're screening people who are baby boomers, so born between 1945 and 1965. They were alive in the 1970s and early 1980s when we actually saw a huge rise in hepatitis C. And they might not remember specific risk factors like sharing needles and those types of things. However, they may have been exposed. And so anyone born between 1945 and 65 should be tested at least once. And then other people that we worry about having hepatitis C. If you got a tattoo that was not at a professional tattoo parlor, that was sort of a home-done tattoo. If you do have a history of substance use and shared needles or other types of drug paraphernalia, it's important to get tested. If you've been sharing razors, that's a reason to get tested. It's not super easily transmitted through sex, but it can be, so of course it's important to use protection. And substance use definitely is a major risk factor for hepatitis C, especially new diagnoses of hepatitis C. And part of the response to reducing the amount of hepatitis C in the community is not only getting people tested and treated, getting people to know their status, but it's also actually expanding access to substance use treatment. We have an opioid epidemic here in Idaho like we have in the rest of the country, and it's super important to expand access to treatment such as methadone and buprenorphine, and to increase access to clean needles for those who are actively using. Again, fortunately, hepatitis C is something that we now can cure in the vast majority of cases, and we expect new medications are coming out all the time, and that it's going to become easier and easier, and hopefully that the cost, which is the biggest barrier right now, is going to go down, and that more people can get this treatment. So go get tested today, and please talk to your doctor about accessing treatment for hepatitis C.